Okay, so I'm ready when you're ready.
I'm always ready.
Thanks for having me.
Absolutely. Well, ladies and gentlemen, my name is Patrick Moen. I'm here with DRC Ventures, and I have the luxury of being able to kick off an interview, but it's kind of one that I didn't know was going to be so interesting until I did like a quick little deep dive the other day about who you are, what you've done. Not only are you married to a magnificent man, but I think you have a very unique story really about what you've done in the science industry. And I guess the first thing that I want to ask, well, first I want to introduce Dr. Annabelle Morgan. Thank you for joining us.
Thank you for having me.
What really got you into science?
Well, I wanted to be a basketball player, so I always have to put that out there. And I was always fascinated with the brain. I always thought of the brain as, my dad would always say anyways, if you think positive, then you'll be okay. You think you're sick, but if you think you're not, then you can get through it. So it was always that kind of, that brain was always the motherboard in the center. Of course, I'm Filipino, so as Filipinos, we think the heart is the center, right? Because everything's about love and care, and that's of course important too. But I was always fascinated with the brain and always incredibly good at math and science. It just came so easy to me. But the dream was to play basketball. So I left Canada. I got an opportunity to play basketball. I spent my college days in New Orleans. And then 2005 was Hurricane Katrina. And I didn't get to play my senior year. And I was like, okay, what am I going to do now? I guess I'll try to be a doctor or figure out where this science world would take me. And then just really started on that journey because, I tell my kids, I have 5, and I tell a lot of my mentees, don't settle in and think that you want to be this or you want to be that. Like, get the internships, go get experience, go get a vibe for it. Because what I didn't know, and I'm a cellular biologist today, I didn't know that was an option for me. I didn't know what that was. And so I was really just shadowing a lot. I've never had a problem just stepping in and walking in to a lab and saying, hey, could I, shadow or intern for you? I'll do it for free. And that's what I did. That was the journey after basketball was taken from Hurricane Katrina. And I will say I thought I wanted to be an MD, a medical doctor. And when I started having to memorize everything and not really understand why and how, that was a problem. And I've always had really great mentors in my life. And a particular mentor I had, her name's Maria Donahue. She said, Annabelle, just do research because you ask way too many questions. You'll never be satisfied as a medical doctor. So go do research. And that's how I landed in the research world.
So you grew up in Canada?
I did. Saskatchewan, Canada.
Wow. How was that?
I'd never live there again. But just because it's too cold, I grew up in minus 50 winters.
Yeah.
And I love thinking about growing up there because I love how we would literally walk to school in these tunnels because the snow that was shoveled from the road and the snow that was shoveled from the driveway created these tunnels on the sidewalk. So as a little kid, you're walking in winter wonderland, and it wasn't very cold because it's a tunnel. And so just so many memories about growing up in such a place. And then a lot of Native Indians are still there. And so learning a lot about their culture and, healing properties that they believe in and what they believe about the sun, moon, and stars. I think it has definitely contributed to my way of thinking today.
Yeah.
So amazing place to grow up. There's a lot of jokes out there about Saskatchewan, but I'm super grateful that that's where I ended up.
Did you have a lot of brothers and sisters?
One brother, Russell, 5 years older than me, still up there.
Yeah.
And talks about moving almost every day.
I asked because now you have a gigantic family, which is amazing.
Gigantic. Gigantic. I mean, larger than anyone will ever realize.
Yeah.
Mostly through my husband, but I've had 5 kids myself. So 1 girl, 4 boys. My daughter's 16, she's the oldest, and then all the way down to 4.
Wow. So I caught small little humble brag of you just because Hurricane Katrina happened, and then you're like, well, I'm not going to do basketball. Let me just try to become a doctor. That's kind of a big leap.
Yes.
And so where did you go to school?
So I went to Dillard University. That's in New Orleans.
Yeah.
So that's where I played basketball. And then I went up to Eastern Kentucky University because that was the first school taking students that were impacted by Hurricane Katrina.
Wow.
So very interesting, very different. I mean, I had to take 4 agriculture classes, like just very different than being in Saskatchewan and Toronto and then New Orleans and then Richmond, Kentucky.
Right.
But grateful for it. I graduated from there, and then I went on to Georgetown in Washington, D.C. That's when the whole, do I do medical school? Do I do the PhD? So that's where neuroscience started for me.
Yeah.
And then cell and developmental biology with cardio-oncology started here at Vanderbilt. And I still work within Vanderbilt, mostly as a visiting scientist, but I've definitely kept my academia ties.
What made you go into the cardio aspect of it when you said as a kid you were always focused on the brain, but then you went into cardio?
Yeah, it's funny. Like with me, it's always been just a really interesting and organic path, not really fueled by my own choices, but definitely fueled by just being open and putting my foot forward and being interested enough.
Yeah.
So I've always been very diverse in what I'm interested in, from music to sports to. So when I see something as a potential issue that I can contribute to, I'm like, hey, why not? And so the cardio-oncology aspect of it was actually, going into cellular biology, you learn about every kind of disease. You learn about every organ. You learn about the root of it all, right? Root, hey, go
No
figure.
pun intended.
No pun intended. So you learn about it all. And, chemotherapy was huge during that time. So we're studying cancer cells. Every kind of cancer cell you could think of, we were putting in a dish as a cellular biologist, studying it, and then studying all the different chemotherapies that were on the market, because, again, around that time, that's where we were seeing a lot of side effects happening with patients using chemotherapy. Chemotherapy is doing what it's supposed to. It's killing cancer. That's why it's on the market. But these side effects are fatal as well. And so that became a big interest of my principal investigator at the time at Vandy, where actually a division called cardio-oncology was just started. And Vanderbilt was a big home for that. So cardio-oncology is the study of looking at chemotherapies and their effect on heart disease. So at the same time that you're studying cancer and chemo, you're studying the heart. And the only way to be able to study the effects that something has on the heart, you have to know the heart developmentally all the way through, how it functions and things that happen that create abnormalities such as chemotherapies.
Right.
So that's how it came to be. It was really just time, place, okay, figure it out. I can contribute there, and that's what I did.
Yeah. Do you think that because of all the things that you saw within side effects from cancer and chemotherapy, that's what really carved your path for medical cannabis or the use of cannabis?
I think so. I think of life in general as just an embodiment of factors, right, that contribute to why you go in certain directions. So I think of life in that way. I never thought about cannabis until, as a medicine anyways, until this story that I'm going to tell you about my son. But I will say, even growing up in Saskatchewan and learning about all these natural methods and not learning about the side effects, and then getting into drugs, because even in neuroscience, we never really thought about drugs and pharmacology and side effects. So then when I really took a deep dive into it, I won't say that I thought right away, like, hey, we should change the way things are going on. We should use natural derivatives. Like, I never thought about that right away. It was kind of my discovery moment.
Sure.
Where I'm learning the reality of these drugs, and then I'm learning how companies or science, makes up for those side effects by creating more drugs. And to be honest, I found that fascinating.
Sure.
I didn't find it necessarily toxic because, again, the chemotherapy was doing what it does.
Yeah.
It's on the market because it's killing cancer. Now, that's why we have to do so many studies, because we have to know when that dose toxicity occurs.
Right.
When does it start becoming a problem for the heart? And so having that information was vital. And knowing that information was good enough for me at the time anyways. And then knowing that we can create something to make up for the side effects, I didn't see that like I see that now.
Right.
I didn't see it as like a double whammy that turns into a triple whammy that turns into, right? And when I say whammy, I mean like, damn, people are now on 6, 7, 8 medications that all have side effects long term.
Absolutely.
And so I never thought of it that way. I think of it being a learning and budding scientist, a lot of discovery, still discovering now. But it's hard to really create your own opinions when you're so dialed into one project.
Right.
And when you're not really there to have an opinion.
Yeah.
You're just there to publish and get grants and, do your contribution as a scientist. But I'm not here to create formulas. I'm not here to, speak about it even. I was just there to do the science.
Right.
So I found it, I still to this day have an appreciation for it, because it's quite incredible to be able to know at what dose does this drug do X or Y, right? I still find it very incredible that we can understand drug interactions. But time and place, is it our go-to? Is it what we're using? Are we being preventative?
Right.
Those are now at the forefront of my mind.
Sure.
When before it wasn't.
What year did you start to look at cannabis as a means to help with side effects?
2016.
Oh, wow. Yeah.
Which feels, it's almost 10 years ago.
Right.
now.
It doesn't feel that long ago, but right?
No,
yeah.
it's almost 10 years ago, yeah.
Do you feel like that caused you to have to look at or maybe unlearn what you were taught in school or what you learned as a scientist?
No. I feel like I sit at a really nice balance, because everything I've learned has absolutely contributed to what I'm learning about plants, plant medicines, cannabis. When we walk into a lab and you see all these jars and containers of isolated compounds that we use to mix and match it for whatever we're doing. What I didn't think about then that I think about now is that those all came from plants.
Mm-hmm.
Right? It's just what we do to it. And a lot of toxicities that are in these compounds, they're toxic in plants too.
Right.
When you extract them out and get it in abundance, it becomes quite toxic. So I feel like even though we talk about how much better natural products are, we still have to know about it scientifically.
Yeah.
We still have to understand, can I take it with my blood pressure medication? So I love that question, because it has absolutely, I think for me and Dr. Christina, has definitely contributed to our ability to craft a beautiful narrative of where medicine should now go.
Right. Yeah. An all natural way of
in an all
understanding.
natural way.
Yeah.
Right.
But
do all the same stuff.
Yeah.
Check all the same boxes, but take away the side effects, right? Take away the negative side effects and think more personalized about the individual, opposed to a group of people that we could just throw drugs at.
Right. Yeah. And I think pharmaceutical plays a very small role in your life at some point in time. There's going to be a need, but for the most point, you should be preventing what you are looking at from a healthcare perspective.
Absolutely. I think that that's something we as a globe need to start thinking more about. And I do think that we are, because we're starting to think more about foods. There was a red color food dye that was just banned by the FDA last night. So, change like this takes time. Mm-hmm. This is big change. And, somewhere in the matrix, it kind of went south when you think about hemp not being available to us anymore, and castor oil, something that was used decades ago on everything. Like
Yeah.
these are things that were taken away from us and taken away from being normalized within society when they're natural and they're preventatives.
Yeah.
Was it a push towards getting people sick and getting them within this pharmaceutical, feedback loop system? I don't know. I don't
Right.
have the answers to that, but you want people to be more educated so that they can take matters into their own hands, because we're not in the place where we just should rely on one doctor who has 500 patients to be able to tailor our best life.
Yeah.
So it's a journey for sure, but I do think people like me and Christina, who are usually found in settings such as academia and such as biopharmaceutical companies, we're taking our talents and bringing them out into the real world. Because even when I go to a Vanderbilt and talk to my colleagues, who I talk to almost every day, I talk to somebody.
Yeah.
And it kind of feels like at times I'm walking into the same lab, same project that I was a part of when I was 20. Like, is this moving? Is there anything going on? And what a lot of my scientist friends appreciate about what I'm doing is that it seems like it's closer to reality.
Yeah.
Like it's actually contributing more so to application, to
Sure.
therapeutic application, opposed to the educational part. Like we've all had our piece in a cellular biology textbook.
Yeah.
But how does that help a medical doctor?
Sure.
How does that help an individual that may just want to prevent something because of known genetic factors? I mean, so as we get better in science, we have to allow medicine to move in that way as well.
Sure. Absolutely. I totally agree. And when you look at the history of like the outlaw of hemp, it's infuriating to see what was done.
Oh my goodness.
Yeah.
And it's just the best. Like I know
Just
you
because
all are
somebody wanted
doing
to-
materials with it, and
Yeah.
it's just the best, and
really is.
So
And
how dare we?
and how quick it grows, how quick it recovers, how it pulls toxins out of the soil.
Yep. Hempcrete and homes, imagine them being made
I
out
know.
of hemp.
It's the strongest rope, paper. There's so many use cases for it.
And it
then
grows like crazy.
It really does. And I think when you look at why it was outlawed, why they criminalized it, you kind of understand that there's a bigger play here to make things that are going to benefit an individual instead of mankind.
That's right. And I don't think it's our job necessarily to lean on the negatives. I think it's important to be educated by it, because it's just the reality of why it was taken from us. But how do we give it back?
Sure.
How do we reintroduce so that our kids can essentially have a better life than we did?
Yeah, I completely agree.
Yeah.
Talk a little bit about because you're on the board of Flora Health, correct? Yes?
I was.
Yes.
I'm not anymore.
Okay.
So that was part of my, cannabis journey. Started by being on the board of Tikun Olam, which is a Israeli company, and they were the first to actually prescribe medical cannabis, and that started in the 1960s.
Wow.
So I was really interested in becoming a part of them and just being a student of the game and contributing the science I knew
Sure.
or know to cannabis. And then I fast forward, moved on to Flora Growth, which is a Nasdaq company, and joined their board in 2021. And the only reason why I stepped down and still love everyone today, I'm still connected to everybody I worked with and still work with some of the same people. I like to say I stole a few of them because they were coming with me. But, they were focused more on moving material. They grow out of Colombia. More on devices and pushing products. I wanted a real life sciences unit, know? And unfortunately, for a scientist, it's hard to ask for funding for that unless you're getting government funding.
Yeah.
Because it's hard to identify your ROI, right?
Sure.
I mean, like when you have a product, you can do market analysis, you can push it out. there's tangible.
Yeah. If people buy it, it works.
It's tangible. And with science, you're like, well, I think in a year I could get this kind of data, and if it doesn't work, it'll take me another year. Can you give me $5 million for that? Maybe down the road it'll be a pharmaceutical product. That might take another 5 years. So there's a lot up in the air when it comes to a real life sciences program. But I think I've been passionate about it long enough. So now what I'm focused on is, why do clinical trials? Why to get to clinical trial? Does it take $25 to $50 million?
Yeah.
Probably more, actually. But the preclinical side, like before we even go into patients, why does it cost that much?
Right.
And why does it take 5, 10, 15 years until I can just go into patients?
Sure.
And so that was always where my passion lied. And I was like, if we can do the cellular studies that are required by the FDA on natural products, we know they're safe. So it's not going to cost that much. Just show the data. And then if we can do animal data that is also required by the FDA, for me, data is king. So if I can show you the data, even though I know in my mind this is natural, this is dumb, I don't know why I'm doing these safety studies, but if I check those boxes, you're not going to have anything to say to me.
Yeah.
So if we go ahead and, even though it's natural, go ahead and do the science, I became really clever. I started to contract and consult globally. So I became extremely clever with my relationships. Mm-hmm. And so where somebody might contract a company to do a cellular study or a toxicity study for $50,000 and it would take 5-6 months, for me, calculate an eighth of both the cost and the time.
Yeah.
Right? And being able to do that all in parallel, now you're looking at an entire preclinical track for under $1 million in under a year. So I started a group with some of my old, colleagues that I kind of came up with in this medical cannabis era, and we started what's called ENEXA, and that's just starting. But the whole goal is to take stranded drugs or natural compounds that people think should get FDA approved because they find that it has efficacy towards a certain condition.
Right.
So let's check those boxes, then let's go into clinical trials quickly, and let's get it on the market, and let's make our new medicine. So that's the goal. It's not about me getting into the lab and formulating. I'm not a chemist, but it is about having a team that could get through this preclinical process, vet things that people say, hey, this works on autism. Really? Yeah. Let's test it out. Mm-hmm. Now let's go into clinical trials, and then let's quickly make it available so that we have better, less toxic medications on the market. And still natural.
And I think that's one of the reasons why you're here, and that's why you're going to be talking with Dr. Christina Ram soon.
Absolutely. Yeah. That's why.
Well, what's one thing that you can look back on your journey through this life, and that's a pivotal moment, I think, that's really helped continue to guide you, whether it's faith, whether it's your research, whether it's your family, something that made an impact on you that you continue to think back on?
Well, every day I think about my son Macario, and just being able to watch. He just turned 9 on January 14th, so that was Wednesday. And,
Happy birthday.
When he was born, he was having uncontrollable seizures. They resulted from a stroke. So he had a stroke at birth, which I didn't even know a kid could have a stroke.
I didn't either. That's
he
scary.
He had a stroke.
Wow.
Right. And so we, that started a really the toughest time I've ever experienced in my life in a baby ICU. And the doctors there tried, and they're the best in the world, and they tried everything to get the seizures to stop. Every kind of drug, every kind of method, and nothing would work. He was having constant seizures, and in a baby it just looks like they're twitching.
Yeah.
So the only way he could eat was through a tube. They immediately had to insert a G-tube. And, just really can't even explain to you what that time felt like between me and my husband, Gramps. It was just like it brought us together. And so at 5 weeks old, Macario had a surgery. It was never done before, where 38% of his left brain was removed. And the part of the brain that was removed is responsible for memory, right side movement, left controls right. So he was never going to use the right side of his body. Comprehension, spatial organization, visual organization. We never could even see his right eye. So, the surgery was in itself very complex. First time it's ever been done.
Wow.
He was only 28 days old. But he was safe. And I think for us at that time, that was okay at that time.
Mm-hmm.
But after a few months of just coming home and not having any communication with your child, the way you say, I look at my baby and, she smiles at me. I didn't get to experience that with Macario because he was under so many medications and he had that surgery that was responsible for so much function. And so it felt very routine. At that time I had 2 other children and his development was, there was no development.
Sure.
I was just feeding him every 4 hours.
Right.
He wasn't crying. He wasn't doing anything a normal baby would do. So 6 months old was like my milestone of, man, I got to do something. And that truly was my awakening. Like, I think I was made a scientist for a reason. And so when you go back and think about growing up in Saskatchewan and understanding the earth and having faith and having a lot of courage, I mean, that's been my life path, is just faith. And having faith in myself for the first time, it was a different kind of faith where I was like, okay, neuroscience.
Yeah.
For a reason.
Right.
Developmental neuroscience, maybe for a reason. And I just dove in and started to think about, what can I give my son that would just maybe boost development somehow. We talk about neuroplasticity. We talk about neurogenesis. Is that real? I mean,
I think it is.
How better to find out
Right.
when I had nothing to lose.
Sure.
As long as he was going to be safe, I made it up in my mind that I was going to try something with him. So that's really when medical cannabis started. And it really wasn't, a lot of people get into medical cannabis because of a blog or another story or a friend. For me, it was reading peer-reviewed published papers and just coming across cannabidiol. So I didn't even think of it as being cannabis when I first came across it. I just saw this compound, very little data, very little research, and I was like, he's already on all these drugs.
Right.
I don't want to pile the drugs on. But what I would like to do is find a way to boost neuroplasticity, right? Is there a way to take advantage of this rapidly developing brain? Can neurogenesis occur? Is that part of the brain going to grow back? I mean, these are things I didn't know, but I sure was going to try.
Yeah.
So in his case, the goal with the CBD and the cannabis was not to, do anything specific other than to just allow the brain to do what the brain wants to do, which is to repair, adapt, and in his case, possibly compensate for the area that has lost.
Yeah.
And so created him a formulation, looks just like that, in a tincture, started putting it through his tube.
Yeah.
And within 2 days, I started to see my son just change. And he just turned 9, he's in the 3rd grade, and he has no developmental deficits. So he's perfectly normal. I published a book with Forbes Books called Mighty Flower, and I talk about him every day.
Yeah.
And so him and the faith and the courage and just the miracle of seeing him every day do what he does, you would never say, oh, that kid must be missing brain, or he's got something going on with him, he might be autistic.
Right.
You wouldn't say any of that. You wouldn't say any of that about him. And it's just, for me, it's brought me so much purpose, because I could walk away now and say, man, have I ever used the tools that I've learned in school, right? And I can just walk off into the sunset with my healthy son. But obviously, I was blessed with this kid so that I can help others. And I know that now. How dare I not? right? So that was definitely the pinnacle moment. I think it always will be. And it's been a pinnacle moment for our entire family. So, I still want to tear up talking about him and just talking about how every morning I don't take it for granted. When I look at him, I'm like, wow.
Yeah.
Thank you. Thank you for my morning coffee, my morning motivation. Here I go.
Yeah.
So
Definitely impacted me, and becoming a new father, and my daughter's only 2 months old. I can't even begin to imagine going through that. So thank you for sharing that story.
yes, absolutely.
Now I know why Dr. Ram loves you so much. Your heart is so big, and I think that you're going to be discussing some of the ventures that you guys are going to be taking on together, and
Yes.
some of the initiatives that you guys are going to be enacting. And I'm so honored to know you and to hear your story and to learn more about you. So thank you very much for sharing that story.
Thank you. That's
Yeah.
meaningful. Thank you very much.
Absolutely, it was a blessing. Thank you for
Yes.
joining us, and I appreciate it.
Awesome. Thanks.